Lapatinib, also known as Tykerb, is a medication used to treat a specific type of breast cancer called HER2-positive. It works by slowing down or stopping the growth of cancer cells. The daily dosage of Tykerb is usually determined by a doctor based on the individual's condition. It is important to take Tykerb at the same time every day, and it is best to take it on an empty stomach, at least 1 hour before or 2 hours after a meal. It is important to follow the prescribed dosage and timing as instructed by your healthcare provider. Before you start taking Tykerb, make sure to read the patient information leaflet provided by your pharmacist. If you have any questions, consult your doctor or pharmacist. Take Tykerb by mouth, either 1 hour before or 1 hour after a meal, as directed by your doctor. This is usually taken once daily, and it's important not to take it more often than prescribed. The dosage will depend on your medical condition, how you respond to treatment, and any other medications you may be taking. Make sure to inform your doctor and pharmacist about all the products you use. Don't increase your dose or take Tykerb more often than prescribed, as it won't improve your condition any faster and could increase the risk of serious side effects. Avoid consuming grapefruit or grapefruit juice while taking Tykerb, unless your doctor or pharmacist says it's safe to do so, as grapefruit can increase the chance of side effects. If you are pregnant or may become pregnant, avoid handling Tykerb or breathing in the dust from the tablets, as the drug can be absorbed through the skin and lungs. Follow your doctor's instructions on how to correctly take other medications with Tykerb, such as capecitabine or letrozole. Some common side effects of Tykerb include nausea, vomiting, upset stomach, mouth sores, mild rash, dry skin, and trouble sleeping. If you experience diarrhea or signs of dehydration, such as dizziness or decreased urination, contact your doctor immediately. Hand-foot syndrome is another possible side effect, which may cause swelling, pain, redness, peeling, blisters, or tingling/burning of the hands/feet. Be sure to avoid prolonged sun exposure, tanning booths, and unnecessary heat exposure. Depending on the severity of your symptoms, your doctor may prescribe additional medication or adjust your treatment. It's important to remember that the benefits of taking Tykerb outweigh the potential side effects for most people. However, be sure to contact your doctor right away if you experience any serious side effects, such as unusual tiredness, shortness of breath, or swelling ankles/feet. And seek medical help immediately if you have very serious side effects, such as fast or irregular heartbeat, dizziness, fainting, or signs of a serious allergic reaction. If you experience any other effects not mentioned here, be sure to consult your doctor or pharmacist. If you are prescribed Tykerb, it's important to be aware that some people taking this medication have developed serious liver problems, which could be fatal. Your doctor will conduct liver function tests before and during your treatment to monitor for this side effect. It's crucial to keep all your medical and lab appointments. If you experience symptoms of liver disease such as persistent nausea, stomach or abdominal pain, dark urine, or yellowing of the eyes or skin, notify your doctor immediately. It's important not to restart this medication if you have previously stopped taking it due to liver problems. It's best to take Tykerb exactly as prescribed by your doctor, at the same time each day. Before taking Tykerb, make sure to inform your doctor or pharmacist if you have any allergies or if you have a history of heart disease or liver disease. Tykerb may affect the rhythm of your heart, leading to serious symptoms that require immediate medical attention. Your risk of experiencing these side effects may be increased if you have certain medical conditions or are taking other medications that can also affect your heart rhythm. It's important to talk to your doctor about all the medications you are taking and any existing heart conditions before using Tykerb. Low levels of potassium or magnesium in your blood can also increase the risk of heart rhythm issues, so it's essential to discuss your medical history and any other medications you're taking with your doctor. If you are pregnant, planning to become pregnant, or breastfeeding, it's crucial to discuss the potential risks and benefits of using Tykerb with your doctor. And as always, consult with your doctor about the best time to take Tykerb and any concerns you may have about using this medication. It's important to be aware that Tykerb can interact with other medications, which can affect how they work in your body. For example, Tykerb can slow down the removal of certain cholesterol medications, digoxin, irinotecan, tacrolimus, trazodone, and others. On the other hand, other medications can affect the removal of Tykerb from your body, which can also affect how Tykerb works. Some examples of these medications include cimetidine, dexamethasone, ritonavir, St. John's wort, azole antifungals, macrolide antibiotics, HIV protease inhibitors, rifamycins, certain anti-seizure medicines, and more. Additionally, it's important to note that many drugs besides Tykerb may affect the heart rhythm, including dofetilide, pymazide, procainamide, amiodarone, quinidine, sotalol, and macrolide antibiotics. Before using Tykerb, it's crucial to report all medications you are currently using to your doctor or pharmacist. Remember to always consult with your healthcare provider before starting, stopping, or changing the dosage of any medicines. If someone has taken too much Tykerb and is experiencing serious symptoms like passing out or having difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call the local Poison Control Center at 1-800-222-1222. In Canada, residents can call a provincial poison control center. Symptoms of an overdose may include severe diarrhea or vomiting. It's crucial to seek medical attention right away in these cases. It's important not to share Tykerb with others. Your doctor may also require you to undergo lab tests and medical exams, such as EKG, electrolyte levels, and heart/liver function, while you're taking this medication. Be sure to attend all your medical and lab appointments, and consult your doctor for more information. Remember to take Tykerb as prescribed by your doctor. If you happen to miss a dose, take it as soon as you remember, but if it's close to the time of your next dose, just skip the missed dose and take the next one at the regular time. Don't take a double dose to make up for the missed one. It's important to stick to the prescribed schedule for the best results. When it comes to storing Tykerb, it's important to keep it at room temperature away from light and moisture. Make sure to keep it out of the bathroom and away from children and pets. When it comes to getting rid of any leftover Tykerb, don't flush it down the toilet or pour it into a drain unless instructed to do so. Instead, properly discard the product when it's expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance on the safest way to do this. If you need more help, call your doctor for medical advice. In the U.S., you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.